Hello everyone, my name is Mark. I'm a student with United States University, FNP 596. Today I will be presenting a case of a 58 years old African American female who present to the clinic unaccompanied and she's a reliable historian. Her chief complaint, I quote, I'm dealing with a persistent cough for the past 3 weeks and sometimes I experience shortness of breath and fever. LM comes to the clinic today with a persistent cough that has been going on for the past 3 weeks. She also reports fever, especially at night, and shortness of breath with physical activities. She denies chest pain, she denies alcohol consumption, and has decreased her smoking habit considerably. She had a history of fibroid and had hysterectomy 5 years ago, and also she's allergic to oxycodone, and she has no known allergy of food. She has a recent history of type 2 diabetes and hypertension. She is taking metformin 500 milligram twice a day, lisinopril 20 milligram daily, and glipizide 5 milligram daily. She has no recent hospitalization. She has a family history of mom having hypertension and her dad type 2 diabetes, and he's a smoker. She's living in a secure environment, try to keep a healthy diet and exercise daily. Her general appearance, patient is a reliable historian, appropriately dressed, alert and oriented. Her vital sign, blood pressure 120 over 82, heart rate 72, respiration 20, temperature 97.9, and oxygen level 99%, height 5.6 feet, weight 170 pounds. And she denies complaint of pain and as respiratory function. When I was listening to the patient's lung, I can hear a combination of crackles, wonkai, and wheezing sounds, which could be a bacterial pneumonia. As differential diagnosis, I have bacterial pneumonia, ICD-10 code J15. Bacterial pneumonia is an infection of the lung. The symptoms can range from a mild cough with or without mucus, fever, mild chills, or serious symptoms like trouble breathing. The treatment guideline is amoxicillin 875 milligram per tablet. Take one tablet by mouth every 12 hours for 5 days. And the second differential diagnosis is gastroesophageal reflex disease, GERD, ICD-10 code K21.9 is the GERD is a lung inflammation caused by stomach acid that enter the bronchial tree. It can cause enough and it can cause coughing and wheezing. Treatment options are diet modifications, antacid, H2 blockers, and sometimes surgery. All GERD symptoms are not present and should also rule out. The another differential diagnosis is acute bronchitis, ICD code 10 J20.9. Acute bronchitis is a viral infection that affects the lungs. The common symptoms are chest congestion, shortness of breath, chest pain, runny nose, fever, persistent cough, rest, hydration, cough suppressant, antibiotic, and in some cases, inhaler and oxygen therapy could be used as treatment options. The patients do not show enough symptoms to choose acute bronchitis. The another Differential diagnosis is asthma ICD-10 code J45. Asthma is an inflammation disease of the airways accompanied by reversible bronchoconstrictions and symptoms such as coughing, shortness of breath, especially at night, persistent cough that may produce mucus. The severity of asthma will determine the choice of medication and the duration of the treatment. Also needs to be and asthma also needs to be ruled out because of insufficient symptoms. To design the best care plan possible, it is vital to consider the most accurate diagnosis by conducting further investigation. A chest x-ray will help determine if pneumonia is suspected. Pulmonary function tests will be important to check for possible asthma. Allergy test might help determine if there's any potential allergy linked to this cough. A bronchoscopy or CT scan may also be considered for a better understanding of the coughing issue. A complete blood count will help identify any underlying infection, treatment plan, and education. Other than mild neuropathy, the physical examination has not revealed any alarming situation because a dry cough is one of the side effects of lisinopril and other ACE inhibitors. The first step is to have the patient discontinue the use of this medication. Losartan, which is an angiotensin receptor blocker, will be prescribed instead of lisinopril, as well as some cough suppressant. The 58 years old patient will be educated on understanding the possible side effect of certain medications that can include a dry cough. Stopping the lisinopril will gradually reduce the cough until it disappears completely in a few weeks. Also, it is vital to adopt a healthy lifestyle, avoid smoking, and abide by healthcare providers' recommendations for a better outcome. A follow up appointment is vital to keep track of the progress of the care plan and determine if modification is necessary, along with further testing and examination.